Hello and welcome to my channel. In today's lecture, we'll continue our talk about bone. So let's start. The bone, as we mentioned earlier, consists of living cells, osteoblasts, osteocytes, and osteoclasts. And this represents the organic component of bone, while the inorganic component of bone is the foam by which calcium deposits, which is the hydroxyapatite, and this is the chemical formula for the hydroxyapatite. The organic components of the matrix, mainly type 1 collagen, and the word organic here refer to any materials that is produced by as a result of the human body metabolism. The inorganic components, along with the hydroxyapatite salts, include other compounds of calcium and phosphate, including salts. Collagen fibers responsible for giving the bone its tensile strength, that is to resist tension, and the hydroxyapatite salts responsible for giving the bone its compressive strength. The ratio of calcium to phosphate varying between 1.3 and 2, and the trace minerals such as magnesium, sodium, potassium, and carbonate also exist in the bone matrix, forming the inorganic component of bone. Now, type 1 collagen composes 90 to 95% of the organic matrix, while the remainder of the matrix, as we said before, is a homogeneous liquid called ground substance, consists of proteoglycans such as hyaluronic acid and chondroitin sulfate, as well as non-collagenous proteins such as the osteocalcin, osteopontin, and bone sialoprotein. The collagen consists of strands of repeating units and of fibers, and it's responsible for giving the bone its tensile strength, and it's arranged in overlapping fashion that prevents shear stress. According to the arrangement of the collagen fibers present in bone, the bone is divided into woven and lamellar according to the arrangement of fibers. The woven bone, or the haphazard bone, is called fibrous bone also, and characterized by a haphazard organization of collagen fibers, and it's usually mechanically weak and appears in the fetal life and in the early stages of fracture healing, before changing into lamellar bone, which is a regular parallel has a regular parallel alignment of collagen fibers into it, and thrown into sheets or lamellae, and is mechanically strong, and this replaces the woven bone in the fetus and in the healing fractures. Woven bone is produced by osteoblasts, as expected, because it's the bone forming cells. They produce the osteoid, and it occurs initially in all fetal bones, but later replaced by lamellar bone. In adults, woven bone is created in fractures or in Paget's disease. It's Paget's disease because of the extensive remodeling of bone, and it's replaced by lamellar bone, which is highly organized in concentric sheets. Lamellar bone, which makes the first appearance in humans in the fetus during the third trimester, is stronger and is filled with many collagen fibers parallel to each other. If you take a cross section of the fibers, you find that the fibers run in opposite directions in alternating layers. By this arrangement, they assist in the bone's ability to resist torsion forces. After a fracture, woven bone forms initially and is gradually replaced by lamellar bone during a process known as bony substitution. Now, for the types of bones, if you want to classify bones, according to shape, they are classified into long, short, flat, irregular, and sesamoid bones. Sesamoid bones are the bones that grow in tendons, like the patella, for example, the kneecap. Now, for long bones, please, regarding long and short bones, don't consider length, but consider the shape or the form of the bone. I mean that although the phalanges are short bones, short in length, I mean, but they are not classified as short bones. No, they are classified as long bones. Okay, so this is the point I'm stressing on. Long bones are characterized by a shaft and called the diaphysis, and an end called an epiphysis. The end is usually rounded head at each end of the shaft. The diaphysis is made up mostly of compact bone with lesser amount of marrow located within the medullary cavity of the bone, which also has the spongy or cancellous bone at the ends of the bones. Now, most bones of the limbs, including those of the fingers and toes, as I told you, are long bones. Don't confuse that. Don't consider the lengthwise, but consider the shape-wise. The exceptions are the 8 carpal bones of the wrist, the 7 articulating tarsal bones of the ankle, and the sesamoid bone of the kneecap. These are considered as short bones. Now, the clavicle is a long bone. It has a differently shaped shaft or ends and are also called or classified as a modified long bone. Short bones are cube-shaped, roughly cube-shaped, and have only a thin layer of compact bone surrounding a spongy interior. The examples are the bones of the wrist and ankle. Now, flat bones, they are thin and slightly curved with 2 parallel layers sandwiching between them a layer of spongy bone. In the case of skull, we call this the diploe. Okay, the skull bones, the upper part of the skull, the calvaria, I mean, is called the diploe because it's 2 parallel layers of compact bone that sandwich between them a spongy bone. Now, the sternum is another example of a flat bone. Sesamoid bones are bones that grow in tendons. They present in tendons either for reasons. They increase the angle of the tendon, and when the angle of the tendon is increased, the leverage of the muscle is increased. Now, that's one purpose. The other purpose is to protect the tendon from extensive friction. Imagine the tendon of the knee joint without a bone in it. It will be easily torn because of the friction against the distal end of the femur and the proximal end of the tibia. Example of sesamoid bones are the patella, the kneecap, the pisiform in the tendon of the flexor carpi ulnaris muscle, and other bones found in the body, like in the flexor hallucis brevis, for example, that goes to the big toe. Now, and in the tendon of peroneus longus as well, at the lateral side of the foot. Irregular bones, they are not classified in the previous categories, so they gave it the name irregular bones. They consist of thin layers of compact bone that surround the spongy interior. The shapes are irregular and complicated, and this is due to many centers of ossification and because they contain bony sinuses. Now, examples of irregular bones are the bones of the spine, the pelvis. You know, the pelvis is formed of the iliac bone and the pubic bone and the ischium. They are all classified as irregular bones. Some bones of the skull are irregular bones. Examples include the ethmoid and sphenoid bones. You know that the skull is composed of around 22 bones fused together. Well, when it comes to development of bone or the ossification process, we have two types of ossification: intramembranous ossification and endochondral ossification. According to the name, they comprise the site at which the bone develops. The intramembranous ossification, the bone develop into from a mesenchyme tissue, and endochondral ossification, the bone develops by ossification of a cartilage model. Now, the intramembranous ossification, it occurs during the formation of the flat bones of the skull, and also the mandible, the maxilla, and the clavicles. The bone, as I mentioned earlier, develops in a mesenchyme tissue rather than cartilage, and the process includes the development of ossification center, then calcification, then trabeculae formation, and finally the development of periosteum. Now, in endochondral ossification, that is ossification taking place in a cartilage model, the process includes development of a cartilage model, then it grows and develops, development of the primary and secondary ossification centers that appear in the bone, and the formation of articular cartilage and the epiphyseal plates, as you see here in the process of the endochondral ossification, starting with a cartilage model that develops by ossification into a mature bone, and this is the epiphyseal plate demarcating the epiphysis of the bone from the diaphysis of the bone, and this is the medullary cavity, which is rich in spongy bone and the blood supply. The endochondral ossification begins with points called the primary ossification centers. They appear during the fetal development and responsible for the formation of the diaphysis of long bones, short bones, and certain parts of irregular bones. Secondary ossification centers occur after birth, and they form the epiphysis of long bones and the extremities of irregular and flat bones. The diaphysis and epiphysis of long bones are separated by a growing zone of cartilage called the epiphyseal plate. Maturity occurs between the ages of 18 and 25, by that time, 25 years of age, all bones of the body are ossified and all cartilage is replaced by bones, fusing the diaphysis and both epiphyses together. This process is called the epiphyseal closure. Now, at this picture, it shows you the process of ossification. This is the bone marrow cavity side, and this is the cartilage side, and we're going this way, depositing calcium. Now, the stages of, or the steps in the conversion of cartilage to bone starts with the zone of reserve cartilage, which is this one. It's the farthest from the marrow cavity and consists of hyaline cartilage that is not yet transformed into bone. Then comes the zone of cell proliferation. It's closer to marrow cavity, and chondrocytes here in this zone multiply and arrange themselves into longitudinal columns of flattened lichens. Then comes the zone of cell hypertrophy. Next, the chondrocytes cease to divide and begin to hypertrophy, much like they do in the primary ossification center of the fetus. The walls of the matrix between lichens become very thin. Then comes the zone of calcification, now depositing calcium salts. Minerals are deposited in the matrix between the columns. Then a zone of bone deposition. Within each column, the walls between the lichens break down and the chondrocytes die. This converts each column into a longitudinal channel, immediately invaded by blood vessels and marrow from the marrow cavity. Now, osteoblasts line up along the wall of these channels and begin depositing concentric lamellae of matrix, while the osteoclasts dissolve the temporarily calcified cartilage. Okay, we'll talk about the functions of bone. They have a variety of functions. The obvious function, of course, is the mechanical function, which provides the skeleton, which gives support to the body, an attachment point for skeletal muscles and tendons and ligaments, and it forms a joint. By means of the skeleton, the individual body parts and the whole body can be manipulated in the three-dimensional space. Also, because the bone is hard tissue, it protects the internal organs, like the skull protecting the brain and the ribs protecting the heart and lungs. Because of the bone tissue, because of the hard bone tissue, bone has a high compressive strength, poor tensile strength, and very low shear stress strength. And expect that because it's very low shear stress strength, this is the primary cause of fractures. Means that the bone resists pushing or compression and resists pulling, but less well than pushing or compression, and poorly resists shear stress. While the bone is essentially brittle, bone does have a significant degree of elasticity, contributed chiefly by the presence of collagen fibers in its matrix. Now, mechanically also, the bone has an important role, or essential role actually, in hearing because of the bone ossicles, the malleus, the incus, and the stapes. They transmit sound vibrations from the drum to the oval window of the inner ear. This is called sound transduction. The synthetic function of bone means it synthesizes structure by means of the bone marrow. The bone marrow is responsible for the process called hematopoiesis, means formation of blood elements like the red blood cells, the white blood cells, and the platelets. Progenitor cells such as hematopoietic stem cells divide by means of mitosis to produce precursor cells. This is in the process of forming white blood cells and red blood cells. But the platelets, on the other hand, they develop by shedding off very large cells called megakaryocytes, not by mitosis. This process of progressive differentiation occurs within the bone marrow, and after the cells are matured, they enter the circulation. Besides creating cells or blood elements, bone marrow is also one of the major sites where old or aged red blood cells are destroyed, together with the spleen, by the way. So these are the sites to destroy the old or aged red blood cells. The red blood cell lifespan is approximately 120 days. So the blood changes itself every 120 days. The metabolic function of bone means it deals with the products of metabolism. First we have mineral storage. They act as reservoir for minerals, mainly calcium and phosphorus. They also store growth factors like insulin-like growth factors, transforming growth factors, and bone morphogenetic proteins and others. Also, it stores fat by means of the presence of marrow adipose tissue, which is the MAT. It plays a role in the acid-base balance by resisting the excessive changes in the pH of the body by absorbing or releasing alkaline salts. They have a role in detoxification in the body, means getting the body rid of the heavy metals. They store heavy metals and other foreign elements, so removing them from the blood and reduce their effect on the tissues, and gradually releasing them for excretion by the kidneys later on, or by sweat secretion. Endocrine organs, it acts also as an endocrine organs, means secretes hormone, plays a role in phosphate metabolism by releasing the fibroblast growth factor 23. This growth factor acts on the kidneys to reduce the phosphate reabsorption. The bone also releases another hormone called the osteocalcin, which contributes to the regulation of blood sugar by means of increasing insulin secretion and increased sensitivity to insulin of the body. It also boosts the number of insulin producing cells and reduces stores of fat. Also, bone plays an important role in calcium balance. The process of bone resorption by the osteoclasts releases stored calcium into the systemic circulation, and it's an important process in regulating calcium balance. It's the under control of the parathyroid hormone and the calcitonin secreted by the parathyroid gland and the thyroid gland respectively. Now, when it comes to clinical significance, of course, we'll be dealing with bone diseases such as arthritis or fractures, infections of bones. Osteoporosis means the bone getting weaker or demineralized, and the tumors of bone. We investigate this as doctors by means of bone imaging, which is called radiography, which takes many forms like ultrasound or x-rays or CT scans or magnetic resonance imaging techniques. and other imaging techniques such as bone scan, which may be used to investigate cancer. Also, we have other tests like blood tests for autoimmune markers may be taken, or synovial fluid aspirate may be taken. Now, regarding bone fractures, especially if there is a significant force applied, also to the bone, to the normal bone, but also it occurs to weak bones, bone undergoing osteoporosis, or when there is a structural problem like excessive remodeling, such as Paget's disease, or if the bone is the site of growth of cancer. Common fractures include wrist fractures, hip fractures. The wrist fractures, by the way, you'll find it common in children because falling on the abducted arm. And hip fractures most commonly in adults because of the osteoporosis. Vertebral fractures usually in car accidents and associated with high energy trauma and cancer and fractures of long bones. Now, tumors, there are primary tumors that occur actually it's a bone tumor, and secondary tumors that are metastases. Metastasis means the tumor has a different origin than the bone. For bone tumors, there are several types of tumor that can affect bone. Like benign tumors include osteoma, osteoid osteoma, osteochondroma, osteoblastoma, enchondroma, giant cell tumor of the bone, and aneurysmal bone cyst. Now, when it comes to cancer and metastasis, cancer can arise in bone tissue, but then they are called, when they arise from bony tissue, they are called primary cancers, but they are less common than the metastatic cancers from other sides of the body. These are called secondary cancers, and with the most common origin of cancer is breast cancer, lung cancer, prostate cancer, thyroid cancer, and kidney cancer. These metastases can either destroy the bone, called lytic cancers, or create bone, called sclerotic cancers. And I think the prostatic metastases are of the sclerotic type, means that they create bone. Cancers of the bone marrow, also inside the bone, can also affect bone tissue, and this includes leukemia, lymphomas, and multiple myelomas. Bone may also be affected by cancers in other parts of the body. Cancers in other parts, like for example parathyroid gland, can secrete parathyroid hormone or parathyroid hormone related peptides. Lung cancers, by the way, they secrete material similar to ACTH, adrenocorticotropic hormones, that alters pigmentation. And this increases bone resorption and can lead to bone fractures. I hope you got the maximum benefit of this lecture, and thank you very much for watching.